The NHS in South West London has already begun addressing the challenges it faces for the future, such as an increasing demand for services and the rising costs for treatments. We'd like to know what you think about some possible solutions. The first is prevention. This means working with local people and services to improve the health of residents so they're less likely to relapse or become ill in the first place.
Disease prevention will obviously reduce the demand that patients make on the NHS. We know, for example, that obesity is a major cause of diabetes, and if we can maintain people's weight at the appropriate levels, then we will see less diabetes and the complications of diabetes. Another good example is smoking. If we could get people to stop smoking, we'd see less chronic lung disease, we'd see less lung cancer, and in my field, we'd see less bladder cancer.
On this ward, once the cardiac surgery patients go home, we have a discharge talk. It talks about preventing any further illness and heart disease. We cover how to take their medications, side effects, what they should look out for. We also talk about wound care. We look at lifestyle as in exercise. We look at diet. The advantage of this is so that the people are empowered and they have all of the information themselves so that they can prevent a readmission by having all the facts.
We've had a huge number of patients that have been going historically to both the A&Es at St Helier and at St George's who have fallen. Now, the reasons you fall are multifactorial, so what we have invested in is a full screening pathway within Sutton and Merton so that any healthcare professional or social care professional can apply a full screen if they believe a patient is at risk of falling, and they will then be sent to the right place. What we have found is that it has significantly reduced the number of falls that we have seen occurring in Sutton and Merton, and the data would prove we haven't also had patients going to A&E who have then fallen.
Another possible solution is accessibility. This means offering healthcare in more appropriate or accessible places and providing clear links to other kinds of local support.
I'll give you an example. I had a lady who came in who had a lump on her arm. Now, previously, about 10 years ago, I would have had to refer that lady. She would have had to wait probably around about 6 to 8 weeks. Now, because I had direct access to diagnostics, I could arrange an ultrasound scan, which then stated that there was something quite sinister looking on the scan. I then managed to have a word with my radiology colleagues, who then arranged an MRI scan quite quickly. Now, because of that, she then got seen by our local sarcoma unit, which meant that she missed a whole step within secondary care, got seen very quickly, but got seen appropriately by the appropriate clinician.
We're now changing the way our A&Es work, and we're dividing them into 3, an urgent care centre, an emergency room, if you like, and then an admissions ward that will hopefully reduce the number of patients that need to come into the main hospital. We can see them, make them fitter, and then discharge them back to their GP, or indeed get the majority of people who walk into our A&Es seen by a GP and then discharged back to their own family doctor.
By manufacturing the products here on site, we can make them bespoke for each individual patient, which improves the safety element for each individual patient so that they can be given those medicines immediately without the need for prescription. By operating a unit like this, we're able to save money for the Trust, resulting in more money being available for the Trust to spend on patient care.
In 2008, we managed to do a joint piece of work between Epsom St Helier and the community services to work to improve the model of care for older people within the community. It was our view that we would take our rehabilitation and assessment service from the acute trust and place it in the community, so they can now access podiatry services, physiotherapy services, occupational therapy services and dietetic services.
Finally, there's the creation of specialist centres of excellence. This means having some types of healthcare delivered by highly trained professionals in larger volumes through a smaller number of specialised centres.
If someone is having an acute stroke, it's better, in fact, for them to drive past the local hospital and go to a specialist centre where they've got 24-hour consultants, 24-hour nursing, 24-hour CT scanning, 24-hour neurosurgery if required. That makes sure that their care has by far the better outcome.
One of the operations that I do is to remove a patient's bladder and in suitable cases, to rebuild a new bladder for those patients. That's not a particularly common operation, but if we concentrate all of the patients who need it from a particular area into specialist centres, that centre may be doing one of those operations each week. That means that the whole team becomes better at dealing with those patients, and the outcomes are significantly better than people who are doing one or two of those operations every year.
So now you've heard about some of the challenges facing the NHS in South West London and some possible solutions. Join the debate and let us know what you think would help improve the quality of healthcare we provide for you as efficiently as possible. We look forward to hearing from you.